Well, South Africa's flight, the SAA flight with more Johnson & Johnson vaccines expected, as we said, on Saturday. The 80,000 vaccinations will add to the 80,000 that are already in the country and being used to inoculate healthcare workers. By yesterday, more than 40,000 healthcare workers had received their jabs. Let's get an update on vaccinations. We're joined by Professor Ian Sanne, who is a member of the Ministerial Advisory Committee on COVID-19 and the CEO of Right to Care. Professor, thank you for being with us on the show. It's good news that more Johnson & Johnson shots are coming. But the other day, I think you were explaining that the idea would be to ramp up to 200,000 shots being given in this country per day if we're going to head to that herd immunity. This consignment in its entirety is only 80,000. So that's just a pinprick in the ocean of what's needed.
Yes, thank you very much for your interest as usual. The Sosonke team of which I'm working with is, rapidly rolling out the accessible vaccine to frontline healthcare workers. Frontline patient-facing, meaning that we're focused on ICU staff, nursing staff, doctors, and support staff in the COVID wards. The consignments that we're receiving at the moment still form part of the clinical research supply that Johnson & Johnson has made available to South Africa. It does form part of a study. It is to look at the impact on a larger scale on the incidence of COVID and severity of disease should incidents occur. What's really important to recognize is that last night the FDA did actually release emergency use approval for the COVID vaccine, for this Johnson & Johnson vaccine. And so the pathways are set for SAPRA to do the same, and then for South Africa to procure the vaccine. So in principle, we have got a large number of vaccines in the pipeline. We, in essence, are focused at this moment on setting up more sites. Tonight, there'll be an announcement of additional vaccine sites across the country. Our supplies are coming in two tranches, actually. The first on Saturday, the next on the following Saturday. We will be ramping up under Sosonke to an eventual 500,000 doses. So we're progressing very well and indeed are really quite optimistic about our program. In so doing, we've really developed the systems of self-registration on EVDS. We have developed the safety desk that enables us to collect safety data on this vaccine. We further have integrated with DATCOV and the NHLS NICD database for laboratories, and we'll be able to track and trace every person who comes onto the program with their potential COVID diagnosis. We do anticipate some will still become infected, but given the results, the really sterling results that have now been used for emergency use approval, we expect a vaccine efficacy of more than 66%, a drop in severe diseases with a vaccine efficacy of more than 85%, and to date on the trials, no deaths have occurred in the group that have been vaccinated, so deaths due to COVID.
So you're saying that you hope SAPRA approval will open the floodgates and we'll get these vaccines into the country. I understand there is a goal of 1 million or so in coming months. Are there clear targets here? Healthcare workers, you as a professor, part of the team working with government, are clear targets being set?
So the clear target at this time is the frontline healthcare workers with the 500,000 doses that we are implementing at present. It will then, the phase one will be to complete healthcare workers across the public and private sector. And then the second phase will begin. It has two target age groups, those most at risk and with comorbidities. And then it starts to focus on critical skills in the country, such as support skills such as police, etc. And in the mining sector has been identified. I do think that once these vaccines become registered, the whole playing field will open up. And then the total doses earmarked for South Africa of the J&J vaccine is 9 million doses. We hope that Pfizer will register their vaccine soon under SAPRA as well. And then Pfizer will become available, and I guess Moderna and other vaccines will follow as the supplies improve.
Well, Moderna now testing, I think it would be a booster vaccine for the variant that was first found in South Africa. So that's happening in the United States. Is that good news? Another potential one for us?
Yeah, so the variant adjustments of these vaccines, the FDA has already indicated that the studies will be smaller. So the safety elements of the big phase 3 studies will be adopted from these. And there will be a much more targeted efficacy comparison with the new variant designs. They may turn out to be a third dose for Pfizer and for Moderna, or potentially replace the second dose. We'll have to see how that works out. We anticipate those clinical trials to begin in the middle of the year, and components of those trials will be done in South Africa.
How's it going? Last time we spoke, you said that the vaccinations, the early ones of the healthcare workers were going well. And there seems to be a buzz, people posting things on Facebook, I guess trying to change attitudes to vaccinations as well. Do you think it's working well and confidence is building?
So I think that it's working extremely well. We set ourselves a target for yesterday to reach 40,000 participants and vaccinees. We have exceeded that target. Yesterday's number was 41,800, I believe. And today we have again probably added another 8,500 vaccinations. By Sunday, the first supply of 80,000 doses will have been completed. That's why we're very thankful that Johnson & Johnson is sending us the next supply for early next week. I'm seeing more demand at this and escalating, improving demand. In fact, the most important thing we do with our data systems is actually focus down on the areas of the country where these vaccine sites are. And we are focused on frontline workers. And general practitioners have been included in this first round. We are adding discrete populations in the next week, such as laboratory workers that deal with COVID specimens. And so progressively, we're on target. Each site is set up. They, in fact, many of them are vaccinating more than 1,000 participants per day, and very effectively. The data systems are settling down very well. And so, in fact, we are very optimistic.
Professor, I don't know if you would like to comment on some criticism about a whole SAA plane being sent to Belgium to pick up 80,000 vaccinations. I heard an aviation expert saying that could cost up to 5 million rand. Presumably, we want to save costs. Any comment?
So it is, that decision is about my pay grade, if I would say that. But indeed, I do think the urgency of the situation did warrant a dedicated transport route. We are very concerned about the cold chain in bringing these vaccines into the country. At this time, the other courier routing would not necessarily have worked, and urgency does actually drive the decision to bring a plane, to fly a plane across. Whether we start in Belgium and bring a plane here and then send it back, or the other way around, I think is the same cost. But indeed, it is costly, but this is supported by a number of sources of funding that do not necessarily rely on Treasury. And the SAMRC is the sponsor of the program, and it was decided that this was the way to do it.
All right, we appreciate your time tonight. Thank you very much, Professor Ian Sanne, who is the member of the Ministerial Advisory Committee on COVID-19, the CEO of Right to Care as well. Now, coming up, we'll speak to the publisher of that publication.